Hello my friends and welcome back to my channel. It's Jendi and today we're going to be talking about opportunistic infections and more specifically tuberculosis and HIV. Now, for those of you who have done my workshops, you are aware of the different stages of an HIV infection. When someone who is HIV positive gets to the final stage of an HIV infection, they are said to be at the AIDS stage. At this stage, many persons develop opportunistic infections if the virus is left untreated. So, what is an opportunistic infection? An opportunistic infection is an illness caused by an organism that usually does not cause disease in a person with a normal immune system. People with advanced HIV infection suffer opportunistic infections of the lungs, the brain, the eyes, and other organs. Opportunistic infections common in AIDS patients include pneumocystis carinii pneumonia, Kaposi sarcoma, shigellosis, histoplasmosis, and other parasitic, viral, and fungal infections, and some types of cancers. So today, as we narrow in on tuberculosis, let's dive into what tuberculosis is. Now, tuberculosis, usually shortened to TB, is a disease caused by an organism called Mycobacterium tuberculosis. The Mycobacterium tuberculosis bacteria can attack any part of the body, but most commonly attacks the lungs, and in this case, when it does attack the lungs, it's called pulmonary tuberculosis. Now, there are two forms of tuberculosis. There's active tuberculosis and inactive tuberculosis. However, only active tuberculosis can be transmitted. Tuberculosis can be passed on by coughing or sneezing of a person with active TB, as tiny sputum droplets contain the TB bacteria. If another person inhales this tiny droplet, he or she can become infected with TB. Now, TB is a contagious disease, meaning that you can get it from casual contact with a person that is infected with active TB. If a person has inactive or latent tuberculosis, it means that their body has been able to successfully fight the TB bacteria and stop it from causing illness. People who have latent tuberculosis do not have symptoms and cannot pass tuberculosis to others. In some people, tuberculosis bacteria remain inactive for a lifetime. In other people, the inactive tuberculosis may become active if the person's immune system is weakened, for example, by HIV. Unlike HIV, however, TB can be cured. To be cured from TB, you need to take a number of drugs for at least 6 months. As we have learned, people living with HIV have weakened immune systems. Therefore, they are approximately 30 times more likely to develop opportunistic infections such as TB, as both HIV and TB weakens the immune system. The presence of one worsens the effect of the other. There are several important associations between the epidemics of HIV and tuberculosis. 1. Tuberculosis is harder to diagnose in HIV positive people. 2. Tuberculosis progresses faster in HIV infected people and accelerates the progression of HIV to AIDS. 3. Tuberculosis in HIV positive people is more likely to be fatal if undiagnosed or left untreated. 4. Tuberculosis occurs earlier in the course of an HIV infection than other opportunistic infections. And 5. Tuberculosis is the only major AIDS-related opportunistic infection that poses a risk to HIV-negative people. Therefore, it is important that people who receive a positive HIV diagnosis are also tested for TB and vice versa. Screening for TB should take place regularly at every health clinic visit.